welcome you to Marijuana Legalization, Present State, Impact, and Future Forecast. In 2012, Colorado and Washington State became the first two states to fully legalize marijuana. Now, 7 more states have legalized recreational marijuana use, with dramatic health policy and infrastructure implications. Today's speaker is a medical doctor who is devoted to increasing knowledge of truth regarding marijuana legalization and its implications. Please help me welcome Dr. Shannon Murphy.
Thank you. So, can y'all hear me okay? Okay, I'm going to take up the whole time. I'm just going to tell y'all. I could probably talk on this for several hours if given that opportunity. But I am a trained pediatrician, so I do want you to know that I come to this topic from a pediatric perspective, okay? So I think that's important to know. Although I'm trained in pediatrics, I spent the last several years in health promotion on substance use, and my focus has been on marijuana. The reason I chose marijuana was because I saw a need. I saw, in fact, there's not a lot of public health messaging right now, like we have with tobacco or alcohol, going on with marijuana. And so I spend my time going around the state, really getting into the schools, to health classes, talking to kids. I do perinatal talks to talk about the impact on maternal issues, maternal fetal issues, and use during pregnancy. And then I just go to whoever asks me to come, organizations, churches, and communities. So what I'm hoping to do today is give you some insight really into what I'm hearing as a physician that may not be getting out into the general community. And what I hope to do, no matter where y'all stand on this issue, is give you guys some, some facts to go home and start up a conversation in your own neighborhoods, right? And that's what it's about. So let's get started. I do always like to say that I have no financial disclosures. I really just volunteer all my time on this issue. I spend most of my time just talking just because people need it. So the American Academy of Pediatrics has released not one, but 2 policy statements actually opposing legalization because of its potential impact on kids and teens and young adults. This is actually a picture of a journal that I get. It's called Contemporary Pediatrics. And for those of you who may not be able to read it, it says Special Report, Generation Weed, and it says the medicine, and there's quotes around the word medicine, marketing, and media putting kids at risk. So one of the things y'all might not know is that many kids are actually choosing to use marijuana over even traditional tobacco, right? And that's particularly true when we look at data from our high school seniors and our college age students. And it's happening, we could propose it's happening for many reasons. One of the things that I like to note, and I think is a contributing factor, is normalization of drug use, right, in many areas of our country. So the messaging our young people are hearing, and what I hear from them, is that it's no big deal, that it's safe, that it's in fact a medicine. And I don't have time, unfortunately, to go into marijuana as a medicine because I think that's a really important topic. There is therapeutic value to the components of the plant, and it really deserves some attention, but we had to cut things out. So I'm happy to stay after to talk with y'all about that if you're interested in it. So let's go over some current trends. I will say that public policy is really lurching ahead of the science at this point on this issue. And in many ways, I would say the science is still in its infancy, or it's still developing. And the reason for that is the studies that I'll share with you today have all been done on a plant or product that is nowhere near as potent as the products we're seeing today, okay? So it's really important for y'all as you leave here to kind of keep an ear out of what's coming through from our research sector, especially our scientific and medical sector on this issue. First thing I'd like to note is that it's a complex plant. It has hundreds of chemicals within it, and about 100 of those are known as cannabinoids. We hear typically about 2, right? THC and CBD. I think most of y'all can say, okay, I recognize those. THC is the mind-altering part of the plant, psychoactive, right? The more THC, the more potent the plant. CBD, not psychoactive, not mind-altering. And in fact, that's probably what we hear the most about in terms of therapeutic value when it comes to seizures in young kids, okay? marijuana impacts multiple organ systems. You know, I talk to kids, no matter how you bring it into your body, yes, it affects the brain, but it goes to your heart and your lungs and your GI tract. If you're pregnant, it does go to the fetus. If you're breastfeeding, it is concentrated in the breast milk, okay? And then finally, how does marijuana work when it gets into your body? And this part of the conversation seems to get lost. It actually acts differently than other drugs, such as perhaps alcohol. You know, we can actually take in a glass of alcohol, beer, wine, not be impaired by that. And actually the alcohol is gone from your body within several hours, right? Marijuana stays on board. It's what we call lipophilic or fat-loving. So in fact, when you ingest marijuana, it is stored in your fat cells. And then it's slowly released over hours, days, to even weeks after use, okay? How long does it stay in the body? Because that's the first question I get from young people typically, right? We don't know the answer to that yet, okay? It varies from person to person, and it varies by how much they use. So the more you use, guys, the longer it stays in, right? So if you're a regular user, it can take 4 to 6 weeks to clear. If maybe it's your first time using, maybe 3 to 10 days, okay? So yes, it has impacts on drug testing. But I think the more important impact as a physician is what we're understanding from science related to those, not necessarily acute effects, but maybe those effects that are kind of persisting as it's metabolized. Because what the science is telling us is that although a person may say, you know what, I'm not high anymore and I'm back to normal, when we've done studies on some of those people, what we notice is that some of them have actually a persistence in decision-making abilities with issues with that, and also concentration. So they may not even be aware of the impact that the marijuana is having on them. So if we take it and we think about our young students, our young kids who are using marijuana during the week and or weekend, excuse me, and then coming to school during the week to learn new material, take or test, that's concerning. You know, we need to elucidate, okay, which do the pharmacokinetics really mean for our young people? What do the pharmacokinetics mean for the workplace, right? Say you have a doctor who legally smokes marijuana over the weekends, then comes to do surgery on a family member Monday or Tuesday of that week. Theoretically, that doctor still may have marijuana on board. And so if there's concern that there's issues that persist in terms of impairment, that's really not okay with us, right? So no matter what the laws are, really important to think about drug-free workplace as being essential, right? No matter what's happening in our states. So if we move forward from the complexity of the drug and we talk a little bit about what we're seeing, I think it's really important to understand that this is not the same drug that, well, I heard somebody say this one, that your grandpa used to know about, right? It's a different plant. It's much more potent. And this is data over 40 years, y'all, looking at the amount of THC in the plant. This started back in 1960, and this data goes to 2011. And what it shows is that over these decades, the amount of THC found in the marijuana plant has increased. You can see that basically in the 60s, 70s, and 80s, and that's when I was young, there was about 3% THC in the plant. Went up to about 11% in 2012. And then if you look at the potency over the last 5 years in Colorado, y'all know what happened here, right? Changing laws. When you look at the potency in Colorado, some of the plants are being tested now with levels even above 30%, which seems really eye-opening to me. So I always ask people just to stop for a minute and think about the 3% THC plants. And then let's think about, let's just say, average 20% THC that we might be seeing now, right? Those are two very different drugs. Because
plants, like all homegrown or all, you know, all like.
This is just average numbers. This is just average numbers. So I don't know about homegrown. So, I mean, some homegrown people have really sophisticated systems, right? So I usually like to say, let's think about the average being closer to 16 to 20%, right? And then as of right now for a plant, and then a long time ago, 3%. We know 3% got people impaired, right? So this is a different drug. And I also would like to mention that one of the things we're seeing is it's no longer just a plant. There are new products out there that are sold legally in certain states that are known as concentrates. And these are synthetically derived THC products. They go by different names: shatter, wax, 710. People use these and they dab with them. This is called dabbing, where you take a dab of the concentrate, put it on the head of a pipe and heat it and inhale those fumes. These products can have up to 90% pure THC in them, okay? Anywhere from 40 to 90%. I will tell you there are no medical studies that I'll be sharing with you today on these products. We have none at this point. These are new products. So let's talk briefly about the health effects, or what we're learning are some of the health effects of marijuana. And I will tell you, again, this is still developing and something that we need to keep an eye on. You know, despite what the media will have you believe, it's not necessarily harmless. There's some concern and things that really should be causing us to pause and think about. We do know it's addictive. About 9% of adults, a little bit higher rates for our young adults, will become addicted. Interestingly, you know, you can see there's a difference between those young adults, and that's because of brain development, right? We know now that the brain doesn't stop developing until about 25 or 30 years of age. So when I talk to kids, I said, right now as I'm talking to you, you know, your brain is developing. It's a 24/7 process, right? So if you have something that gets in the way of that, some obstacle, you're more likely to have those long-term effects that might predispose you to addiction. We know that, in fact, that NIDA reports, our National Institute on Drug Abuse, that the rate actually increases for those who use more daily, like up to about 25 to 50%. When you ask people what in fact was their people who use illicit drugs, what in fact was their first illicit drug of choice, is typically marijuana. Now that doesn't mean though that everybody who smokes pot's going to get addicted. Certainly doesn't mean everybody who smokes pot's going to go into harder drug use, right? But just a relationship between all drugs in terms of where it functions in the reward system. So one of the things you'll hear about is the relation using, you know, could the opioids be an answer for marijuana addiction? I don't know. And it's something that is being investigated and looked at right now. I will share this particular study with you. This is from the American Journal of Psychiatry. And they looked at people who had past year marijuana use, and they actually found that these folks had a higher risk of actually developing a prescription opioid use disorder. Don't have time to get into it, but I think it's something that needs to be investigated. You know, is this something that we need to look at? Or is there concerns in terms of the relationships between the marijuana receptor, CB1, and the mu receptor, the opioid receptor? What's happening there? So more unanswered questions than anything, but worth noting. We are seeing an increase in emergency room visits nationwide. Typically, they're going for cardiac issues or pulmonary issues or even mental health issues. If you look at data in Colorado, this is the average marijuana-related hospitalizations over the 10-year period as their laws have changed. And you can see, in fact, they've also had an increase in their marijuana-related hospitalizations. The American Academy of Pediatrics released a study this past year that looked at the impact of marijuana legalization on adolescent emergency room visits, defining adolescents as 12 and up. And what they found was that visits secondary to marijuana more than quadrupled over that 10-year period. So something to be concerned about, and I think speaks to why public health messaging is so important for our young people on this issue. We do know marijuana use affects life outcomes. When you look at, this is from the Journal of the American Medical Association, but I want to focus a little bit on some of the organ system effects, because I think that will empower y'all to be able to have this conversation with people to say, hey, I notice you're using marijuana. Let me tell you some of the concerns we're seeing with that. It's not heart healthy, at least there are early data coming out. There's links to strokes and arrhythmias and even sudden cardiac death and hypertensive mortality. It's not safer than using a traditional tobacco cigarette. You know, I hear that sometimes from young people. The American Lung Association has actually said that marijuana smoke has many of the same toxins and cancer-causing agents that, in fact, tobacco smoke has. That marijuana smoke deposits tar in the lungs, similar to tobacco smoke. Very interestingly, this is a study out of Denver last year. that looked at little kids under the age of 2 admitted for an illness called bronchiolitis. And for y'all, those of you who have kids, it's that wheezing illness sometimes kids get when they get a cold when they're little and they wheeze and kind of cough and all that stuff. Anyway, they looked at the kids who were admitted at this Denver hospital, and they found that 16% of the kids who were admitted with bronchiolitis actually had positive drug tests for THC. So it goes without saying not to use marijuana in front of kids, right? No matter what the laws are. But I think that's also an important point of conversation. I also want to bring your attention to a new illness we're seeing. So as a drug is used more, sometimes we'll start seeing the development of illnesses that maybe we didn't know about before. And remember, we're dealing with more potent plant as well. So this is called CHS. It's cannabinoid hyperemesis syndrome. It's something that doctors really don't know very much about. And so that's why I'm trying to spread the word, because some people are coming in with these symptoms and getting huge workups unnecessarily, right? Because if we know they're regular marijuana users, we can kind of make the diagnosis without having to put those patients through that and just get them better. So it typically affects regular heavy users. It can last hours to days. I saw one report that a doctor saw that lasted 13 days while a patient was in the hospital. And it's acute abdominal pain and vomiting, and really recalcitrant vomiting. The only thing that makes these folks feel better is hot showers. It's almost like a hallmark of the illness. But our typical antiemetics that we would use don't work as well. So the way to treat it is to get the marijuana out of the system. And most people can't go back to smoking because this will come back typically. So something to think about there as well. So this is probably my most important slide and really shows and speaks, I hope, to why I felt important to at least start talking about some of the health effects related to marijuana. This is actually something I cut and pasted from an email I got from Medscape. And it was a press release now almost 2 years ago. And it was entitled, "Legalize Cannabis in the Brain. The National Institute on Drug Abuse Sounds the Alarm on Neuropsychological Decline, Cannabis and Psychosis, and Contributor to Mental Illness." So the reason why I think this is important is because when I give this talk, I usually ask the audience, how many of you saw this release on mainstream media or even just heard about it from other people? And honestly, y'all, in 3 years, I've had like less than 5 people raise their hand. And that's a problem because we're having our National Institute on Drug Abuse, our organization for educating us on substances, say, hey guys, we got a little problem here. This is a concern. We want to make you aware. And our young folks who may be making decisions about drug use, right, aren't hearing about it so they can make informed decisions. That's a concern. There's lots of studies looking at marijuana's effect on the brain. This is just one example. This is from the Journal of Neuroscience in 2014. And it looked at marijuana use for people, young adults, young people, because what we're talking about is people under the age of 25 to 30. They're the ones most perhaps at risk for those chemical changes, those structural changes that we hear talked about in the scientific journals. But this talked about young people who were identified as light users who actually had differences in the size and shape of certain areas of their brain. They also had changes in their motivation and decision making and attention and memory and processing of emotions. One of the biggest studies looking at marijuana's impact on IQ came out in 2012. It was a prospective 30-year study looking at individuals starting at the age of 13 and following them up into adulthood. And what it found was that those who had persistent, very heavy, regular cannabis use from adolescence into a young adulthood, some of them showed a significant decrease in IQ. We also know that marijuana can impact mental health. This is from the National Institute of Medicine, Science, Engineering, Medicine. It was a report that came out this past July, and it's talking about the health effects of cannabis and cannabinoids, and it's excellent, and it looks at lots of different outcomes, lots of different things. It's easily Googleable, I don't know if that's a word, but easily looked at. Anyway, one of the things they talk about in this report is in fact that there's significant statistical association between marijuana use and mental health issues, especially like things like psychosis and suicidality. There's been a multiple pieces of literature on marijuana and its link to psychosis. This is one example. It's from Lancet in 2015. And it really found that these higher potency products, guys, are causing some people to have episodes where they're hallucinating or feeling paranoid. And these were people who were just using maybe even just once a week. Our American Journal of Psychiatry put out something in 2016 that said, look, our adolescents are really likely to have these subclinical symptoms, and that effect can last even if they stop using. So when you sometimes I'll hear in the media one thing that does get picked up, or doctors say, now that I'm in this legal state, I have a person coming in sometimes once a shift with psychosis related to these higher potency products. So something to also get messaging out on. So, when we talk about the confusion surrounding marijuana, because there is confusion, and a lot of times people will say to me, Dr. Murphy, everything you said today, I've never heard it before, and I get that, and that's why I'm here, right? So the confusion is not by accident. Marijuana is backed by a very well-funded industry. And a very powerful industry. And they often talk about how they can solve economic issues with their drugs. We actually have 2 legal drugs already, alcohol and tobacco. And if you look at data from in terms of how much we take in related to sales and taxation versus how much we lose related to medical illnesses, or in the case of alcohol, highway safety issues, or not even to mention emotional costs. If you have a family member who's addicted to that, it's actually a money loser for us. This is data from Colorado, I think it was 2015 or 16. And it basically showed that Colorado took in about $115 million in marijuana sales. And what they showed was that actually that amount was really a very small, less than 1% of the overall budget. Andrew Friedman, who was the director of the Colorado marijuana policy, kind of the implementation of it when it first came out, was quoted as saying, you do not legalize for taxation, it's a myth. You're not going to pay teachers, you're not going to pay roads, because all the money goes toward regulation. I mentioned to you that, in fact, the confusion surrounding marijuana is not by accident, and it's very reminiscent of another industry that we all know very well. But as a matter of fact, our young people don't know very well. I think the older you are, the better you know it, right? Some of y'all might remember some of these advertisements. Smoking is good for you. 9 out of 10 doctors recommend it. You may remember the Marlboro Man, and he was so cute, and the Virginia Slims woman, and Joe Camel. Remember, he was a cartoon character to get kids to smoke. And you know what? They did a really good job. They did a good job, right, of getting us all to use tobacco. And these actually, just so you know, these slides are from a dear friend of mine who runs a national prevention education company called Eventi. So these are available to you all if y'all were interested in doing a showing of, she does a beautiful job of talking about the tobacco industry and the marketing of addictive products. When it came out that scientists and doctors were trying to say, hey guys, slow down. We got some concerns here. Let's start figuring out what's happening. They really stood out in the tobacco industry, really bought up media and said, you know what, we don't know that that's true. There's lots of controversy on this. Don't worry too much about it, right? And it wasn't until the 1990s, and that was not a long time ago, that here they are, our tobacco men, industry leaders, who got up in front of Congress and under oath said, you know what, tobacco's not addictive. That people looked at them and said, okay, we got a problem. We know from science that this is addictive. They're under oath saying it's not. they don't really care about our public health and safety. And that's when we started making the change, right? We started kind of being like, okay, this is enough, is enough. And one of our greatest accomplishments, I think, in public health has been the decrease in tobacco rates. I mean, it's dramatic, and it continues to happen, right, year after year. So we have a messaging issue. We have a messaging problem. When 1 out of every 2 Colorado young adults aged 18 to 25, and remember, under 21 it's illegal, have tried marijuana in the past year, there's something happening that we're not doing a good job of educating others on, okay? I don't know if any of y'all saw this on CNN. This was New Year's Eve. And this was covered. And I heard from some of my friends how concerned they were because they gave their kids a nice little treat to stay up to watch the ball drop, and then unfortunately had this on TV. So, you know, we obviously I think it speaks to the messaging issue. So let's talk briefly about legalization. As was mentioned, several states have legalized now. And they're all in varying states of legalization, guys. So, you know, we don't have data from all these states, right? So most of the stuff I'm presenting today is from Colorado. And I think it's really important to know that it hasn't necessarily just been about allowing, I can really care less about a 50-year-old smoking a joint in their basement. The concern I have is that commercialization of marketing that we're starting to see happen. And I want to show you some of the concerns with that. These are just examples of marijuana shops in Colorado. These are what they call medical marijuana shops, because when states vote on marijuana as a medicine, it's not sold in a pharmacy. We do have marijuana medicines sold in a pharmacy. Actually, even in Alabama, I could write them for you. They're components of the plant that are sold. But when it's voted on, it actually is sold in shops such as this. This is an app you can download when you go to Denver to find the marijuana shops. There are more McDonald's and more marijuana shops than McDonald's or Starbucks, and most of them, sadly, are located in lower socioeconomic neighborhoods. This is from one of the councilmen who said we have to stop this undue concentration, especially in communities that haven't seen a grocery store or a business that supports the community health in years. I mentioned to you that marijuana was no longer just a plant. I showed you pictures of concentrates, which are those pure THC products. Edibles are also a significant amount of marijuana sales in those states. Many of them look like candies that you would buy in the store. And I am concerned, as are many, that this, you know, a 50-year-old man doesn't care about getting high on a ring pop. There's only, in my mind, one group of people who like the idea, who might be attracted to the idea of drugs and candy, and that's our younger people, right? But some of the data we're seeing to share with you that makes it a concern, and these are just different products, are that we're starting to see poisonings in kids under the age of 5. And so since over the past 10 years with legalization, the amount of kids under the 5 who have been poisoned by these products has increased dramatically. So I think that's the concern as a pediatrician I have here today. You can look nationally, there's been a slight increase in poisonings, but you can see in Colorado it's been dramatic. And these kids you know, can't tell the difference in these products many times. The concern as well, besides some of the products with these young children, has been the proliferation of marijuana ads that's alarming addiction researchers. One of the journals, the Journal of Drug, Alcohol, and Dependence, says, look, about half of our young marijuana users are seeing advertisements, and those kids are using a lot heavier and newer products. So they're making an impact on those young people. And these are just examples of different marijuana advertisements, coupons, back to school specials, what to do if you do get psychotic or have psychosis symptoms when you've used, these are ads on how to use the product, billboards. This is just from a few months ago, my friend in Colorado sent it to me. This is Subway, Bowl It or Roll It, which is, you know, kind of a take off of how to use marijuana. And those things I think we know from public health really affect what we call descriptive norms for our young people, right? Because it becomes like, oh, okay, this is something normal and part of our culture. And then these are just examples of products and that you can buy related to it. So lots of things go into drug use for our young people. Perceived harm, we talked about that. Typically, as risk drops for a drug, the data shows over 40 years that as risk, perception of risk drops, use typically goes up, which would make sense. Also availability, you can look at alcohol. That's still our number one drug, right, for our young people concerning, right, is alcohol, right? So an easier a drug is to be had. And then finally, social norms. How is a drug perceived in society? So if we look at rates of marijuana use for our 18 to 25-year-olds over the last 10 years, what you can see, non-legal states are blue and legal states are orange. And what you can see is that the rate of use is actually increasing dramatically higher than the rate in non-legal states. So in legal states, the rate of increase was 48%, in non-legal states, 18%. If you look at all 50 states, and I know y'all can't see it way back there, but if you look at all 50 states and you look at what kind of laws they have, the states that have those legal recreational laws have use rates for age 12 and older higher than states that don't have such laws. This is the data typically, so lots of states are pulling in data, but this is from Colorado, and they pull in data from like the hospitals, the Poison Control Center, the police association. And so I don't have time to go through all this, I just thought I'd just briefly touch, but you can find this online. They put one out every year, and they have a summary in the front, so you don't have to read the entire thing, which is pretty extensive. We are seeing a hit to highway safety. The Governor's Highway Safety Association last April put out a report and said that in fact drug driving is surpassing drunk driving for the first time. And so we're seeing that also in states. This is Colorado's rates of marijuana-related traffic deaths. We have some data coming out of Washington State after legalization, the impact to the roads. Law enforcement, black market is still sadly going strong. That was one of the things that was said, look, we can get rid of this black market, which I think is a good thing for all of us, right? Unfortunately, it has thrived, and we're actually seeing, and a lot of it comes from these home grows within the house, because if you can grow 6 to 12 plants, and they're not small, they're pretty big, it's thousands and thousands of joints. I mean, there's no way one person could use that. But this is pounds of Colorado marijuana seized by the U.S. Postal Service over the last 10 years. You can see that's increased as well. If we look at student marijuana source, because another thing that we were hopeful, I think voters were hopeful for, was that, listen, we'll get this out of the hands of kids. But the black market, about 24% still buy off the black market, 45% from a friend who obtained legally, and then from parents as well. This just came out 2 weeks ago. It's just a screenshot of an article in Oregon, Portland. They did a sting to see how many of these shops are selling to minors. It was about 25%. So obviously not acceptable. These are just pictures of illegal grow sites in those states that are continuing. And crime as well has increased. The DA in Denver said we've actually seen crime rates go up. It has not gone down. And of course, causation can't be extrapolated, but he did note that we see the black market thriving. So a national conversation on marijuana, I mean, there's lots to talk about. As I mentioned, what I hope to do today is just at least give you another side, another view of things, give y'all some data to think about. The more people who are affected by it, we are starting to hear a little bit from those people, and I think it's a good thing. We want people to be healthy. We want people to be live in drug-free communities. And so this is Oregon teen fights back against marijuana ads. Business execs say get rid of pot. Governor Hickenlooper, went on TV and really downplayed the issues they were having. And, experts from around the country wrote him a letter and said, you know what, we really demand you to start talking about this a little more accurately so people can make, accurate, good decisions on this. And if they're deciding to go ahead with legalization, well, how do they do that, right? Because obviously Colorado's having some concerns. There's a couple of ways to legalize marijuana. One is through the legislative process, like in the state house. Another is by public ballot. And there are states that say no to it. You don't hear about it a lot in the media, but they do say no. And one of the hardest things for prevention people, though, is to buy ads when it is out to the public ballot. They can't compete with the marijuana industry's the money. You know, the marijuana industry, I think, put $64 million into states to advertise their product and try to get it passed. Prevention folks don't have that. There was one state, Arizona, in 2017 that did actually was able to get the same amount of money that the marijuana folks did, and they ran an ad. And that was the only state that did not legalize because they showed this ad to the public. I think it speaks volumes because it's two representatives of the Colorado community talking about it. Let me play it for you. It just takes 2 seconds.
4 years ago, Colorado voted to legalize marijuana. Colorado now leads the nation in the teen use of marijuana. Marijuana edibles are marketed to children. And marijuana-related traffic deaths have increased 62%.
We were promised new money for education. Instead, that money's gone to marijuana regulation in the pot industry. Denver schools got nothing. In one Colorado hospital, 50% of newborns tested had marijuana in their system. Don't repeat our terrible mistake.
So my message is time to start a conversation. Whatever that conversation is for you on this product. I say right off the bat when I talk to young people, legal doesn't mean safe. Look at tobacco. Look at alcohol, right? We just have messaging in place for those things. And we're not doing a great job. I mean, we're doing a great job with tobacco, but alcohol use in young people is still really high. So number one, legal does not mean safe. Our public policy is really plowing ahead of science. There's health concerns, you know, and even if we don't have it all worked out, there's enough there that really should be causing us to say, okay, let's just slow down and see what's happening here. We don't want more people to be hurt by a product out there that they have not had full information on. From a prevention standpoint, drug legalization is difficult for prevention folks. You know, drug-free coalitions in the state of Alabama have a very hard time counteracting that messaging of legalization with the young people. It's been very difficult. I think as public health advocates, we need to prioritize education on this issue. And this is, I think, a really telling slide. You know, we are here, and I often say to people, you know, what would we have done if we had gotten in front of tobacco? You know, what would we have done at that time? And so this is, I went to the United Nations a few years ago to the International Drug Policy meeting, and this was the messaging done at that meeting: just prevent, don't promote. And so I'm done, and I finished on time, so we'll have lots of time for questions, and I welcome them, and thank you for your attention. Thank you.